stereotype that it is a woman problem?
Yes, thank you, Aseto. I mean, breast cancer in itself, there's a lot of stereotypes and myths around breast cancer. But first of all, to introduce the breast cancer itself, I'll want to establish that it's an interaction between the genetics and environment. You'll find that for breast cancer to develop, majority of them, it's sporadic. So we're meaning it's developed from a point of a chance. But we have this percent, 5%, who will develop because they have mutations in their genes. And what we're talking about is BRCA1 and BRCA2 mutations. Once you have these mutations, there are changes within the tissues that predispose you to having the breast cancer. It's funny that you've introduced the issue of women and men, because majority of people actually think breast cancer is for women. But the reality is breast cancer affects both men and women. Women have a higher risk of having breast cancer, but nonetheless, men still have a risk for having breast cancer.
Now, Dr. Kimtai,
yes.
What are the risk factors associated with breast cancer?
Yeah, thank you for the question. I think the risk factor sometimes would be, best divided into two. So there are some risk factors that put someone to like a higher risk group. The higher risk group here would be something like you have 1 or 2 family members, like first degree relatives who've had breast cancer. The other thing is someone who was exposed to like radiation, probably when they were young, sometimes 20 years. Some tumors like lymphomas would require radiation, and that is how they have cumulative effects over the years. The other thing is when you've had breast cancer before, or you've had like a biopsy, something you took a sample out of your breast tissue and it came back to be abnormal. Those are some of the maybe 4 and a bit some more that would put you in the higher risk category. Majority of the people would have, I can group the other things like the factors that increase the risk of breast cancer, but they are not as high as the 4 I've already mentioned. So one of the things would be something like, conditions in which you have prolonged exposure to some hormones in your body, like specifically estrogen. So if someone has an early menarche, menarche means the first time you have your menses.
Okay.
So most of the time someone has before like 12 years of age, puts them at higher risk. Someone has a prolonged, like late menopause. Some people have beyond 50s. Even like prolonged period at which, like late age at which they have their first full-term pregnancy. Okay. People who have their pregnancies after 30 years of age have been shown to have an increased risk. Other things would be lifestyle factors. I know people are keen to know.
Exactly, that's where I was coming.
All right.
You've mentioned 2 things, exposure to radiation and lifestyle.
Yeah.
Exposure to radiation, could that be, even the sun has radiation. So, yeah.
Yeah, I think in terms of if you are to stratify and say what is the relative risk that puts you or increase the risk, it's not as significant as the other factors I've told you about. Most of the time, the ionizing radiation from the sun, sometimes they cause like skin malignancies. Yeah? That is the one that has been more associated with it. I think, before, as you mentioned the lifestyle, I think this is where we've had these questions more and more. You're talking about obesity, alcohol consumption, physical activity. I'll mention even alcohol. Most people would be surprised to know even a drink per day actually would increase the risk of breast cancer even 4 times. Something like physical activity, they have been shown actually to increase like 25 times the risk of breast cancer. Obesity is a bit, sometimes can be complicated. Like for premenopausal women, meaning before menopause, some of them, most of the time it has a small risk reduction in the occurrence of breast cancer. After menopause, now the risk of breast cancer increases when someone is obese. Remember, obesity also has multiple other interacting conditions, diabetes, hypertension, and ovarian cancer and endometrial cancer. So those are the kind of conversation we would like to also ensure people are aware.
Now, Mwenga, does breastfeeding increase the chances of breast cancer? And also, as we talk about breast cancer, there's always self-examination that someone can undertake at home to just know their body. Yeah. How frequent are they supposed to do that?
Those are actually two very important points you've raised. One is breastfeeding. So literature says if you prolong the duration of breastfeeding in the extent of more than 1 year, you actually have reduced risk of having breast cancer. But again, what my colleague alluded to, there's what we call absolute risk and a relative risk. Now, breastfeeding is a relative risk. Now, to answer your second point, the issue of breast self-examination. So when you're talking about breast screening, there are actually three components you want to talk about. One will be breast self-examination, what you call BSE. The next one will be clinical breast examination, and the last one will be mammogram. Now, when do you start to do breast self-examination? That is BSE. So it is advocated to do from age of 25, and you do it at a frequency of between 1 to 3 years. This can be done at home, and all the daughters, all the mothers, all the men should be able to be doing this at home, and just being aware that breast in itself is a problem in the world. Like if you look at the global statistics, we're finding, as per the reports in 2018, up to the tune of 18 million new cases every single year. If you look at Kenya right now, the three leading causes of death, breast cancer is among top 3. So we have infectious diseases, cardiovascular diseases, and cancer comes as number 3. And if you look at what cancer causes these deaths, you find that the leading cause of incidence in new cases of cancer, breast cancer is number 1. If you look at the leading cause of cancer in women, then breast cancer and ovarian cancer are topping that list. So this is only to point out the need and the importance of actually doing breast self-examination.
Now, Dr. Kimtai, are there some medications that someone would take, say family planning, that are hormonal based, that could predispose you to an increased chance? And as we talk about that as well, what are some of the common symptoms of breast cancer?
Yeah, to your first question, I would answer, like hormonal, or drugs that people take and increases the risk. The combined oral contraceptives, it has estrogens and progesterones. As I had said before, prolonged exposure to these hormones in your body, either in endogenous, meaning it's within your body, or exogenous, from outside, just like a drug you take, it will increase. So definitely that will actually increase. To your second question, so sometimes, even before I get to my point, like in addition to what he had said, Kenya has had interesting period of transition. The advancement in her treatment, in terms of targeted therapy, we're having now like something like trastuzumab, which was not available before. So those are now commonly available in our setup, and has actually changed the landscape on how we treat these diseases.
All right. So now, as we talk about that, how does someone has gone through the process of treatment? Maybe there's amputation that has happened. So how then do we have them if it's to reconstruct and to help them live a normal life?
Yeah, that's an elephant in the room. I mean, majority of patients who undergo, actually they're diagnosed with breast cancer, they eventually will end up having surgery, which is the mainstay in terms of treatment. The challenge comes about when you have a right breast cancer and the left is normal, and eventually when the right breast is resected, then there's asymmetry in the body configuration. And there are myths out there, and there's fear among women that, you know, the partner will feel a bit different, and, you know, the interaction will be different after the surgery. Now, we are here to say there are a couple of options that can actually be taken about after a surgery has been done. One of these is what we call generally breast reconstruction, and they can be in two ways. You have the putting of implants, or you can actually use autologous tissue, which will act as tissue, breast tissue, to mimic what was resected. And this is actually available in the country. We have some challenges going on, but this is very available in the country. In fact, as we speak right now, Tenwek is planning, or rather is on the verge of doing a 14-day-long camp to actually do breast reconstruction. We have looked around the challenges. We have recruited both local and international experts to work on our patients who have resected from breast cancer, to make sure they have a breast reconstruction, improve their quality of life, and make sure they're having a good life after resection.
Now, Kintai, yes, I want us to talk about women, not women, about women. Okay. Now, we've said that breast cancer not only affects women, but also as men, right? Yeah. So how is the best way for Aseto to go through self-examination? And how do I go about the entire, I walk into, go see my doctor, and I want you to check me out for breast cancer?
Yeah, thank you for the question. So again, breast self-examination was proposed and has been advocated for a while. The main reason for that would have been to ensure people know what is normal. Most of the times, if you don't know what is normal, you know what is abnormal. So the idea there would be, are you able to do a breast self-examination? That's the first key point, so that you know when it's abnormal. A few things, like someone who has a lump, you know, or a mass, the breast.
Someone would say it's just a pimple.
It is true. But then you have to look at it this way. It is in the breast tissue. Is it in the nipple? Are there any skin changes? You're thinking about, you know, dimpling, sometimes like orange peel. We call it peau d'orange. But do you have nipple discharge? Do you have like some nodes or some swellings, even in the armpit or the axilla? Those are some of the signs that something is not okay. So those are the abnormal findings. But to start with, it should have been like everyone is aware on how to do breast self-examination. There are so many videos out there. But the idea actually is to be able to, you know, circumferentially, or at least spirally, you know, going from one point to another in a circumferential way, making sure you know what's normal and compare to the other side. Because sometimes you have one side is bigger than the other side. For ladies, we know that sometimes ladies have a, you know, one side might be slightly bigger than the other, but if it's grossly abnormal. Again, so you get it from the examination. Then the doctor examines you. There's clinical breast examination. The second bit have been mammography as part of the screening that you have already alluded to. One thing I will say is breast cancer, even for males, is treatable. The only question is, at what point did you catch it? So that is why screening is important. We need to detect while they're at early stages, where we're able to provide treatment that will actually target curative route other than palliative setup. Again, surgery is the mainstay, meaning surgery will have to be one of the things. The difference here would be two things. Operation will be key for male breast cancer. Two, most of these patients who come with male breast cancer, they may have some genetic mutations, as we've said before. And these genetic mutations, like what my colleague has talked about, you know, he said BRCA. There's 1, 2. There are some associations of other cancers. So someone who presents with only breast cancer, their family has to be followed up to ensure that they don't have other additional cancers like colon cancer. They also, you're talking about ovarian cancer and others, depending on which specific genetic mutation. So there is treatment, and I think seeking earlier care would be key in this case.
So, Dr. on your day-to-day lives, you deal with a lot of misconceptions and myths that do exist. What are some of the things that you deal with and you're like, nope, that's not true?
Yeah, that's usually a challenge. I mean, you'll really take your time to be as compassionate to your patient as possible. But we live in a community that has cultures and has tradition, and there are stories that go around the estates and the villages. So the challenge comes in when someone comes with misconceptions, and some of them will be, for example, you know, a common one will be once you go for breast cancer surgery, you don't make it in life. I mean, your days are numbered, which is not true. The problem is what usually happens is I will have a family member or a villager who had breast cancer. I don't know the staging. Perhaps they're in the last stage, you know. And what happens is they are doing palliative management. But once they do the surgery and, or rather they are told to do chemotherapy, they don't get well, eventually the whole community will know, you know, that individual had breast cancer, went to hospital and things didn't turn out well. So people usually come with that misconception. But the reality is, if we're able to do breast self-examination, we get the breast early, then for sure breast cancer is treatable. Now, another one I've had before is the issue of mostly in the female side, they will be afraid to have surgery after resection. So they will always say, you know, Mzee will not be happy with this. My marriage will fall. But I want to say breast reconstruction is there. It's available in Kenya, and that can be done. Plus, it is more important to be alive than to be not there but have Mzee. So number one is to be alive, and then we can always take care of you by doing breast reconstruction.
We'll explain to Mzee later.
Yes.
Yeah. So, so let me come to you real quick. How can a healthy lifestyle reduce the risk? And then we'll close with you with a question: how can people become more aware of breast cancer?
Reducing the risk. So, so a couple of things. One. We know at this age that there are two main things. Your genetic makeup. Sometimes you may not be able to change. What do you do about it? Intensive surveillance for someone who is known to have, you know, those mutations. Again, in Kenya they are available. You can actually do that test, and you're able to follow them intensive. There are many modalities that you can use. You know, 6 to 12 months. Doing MRIs, sometimes even doing like what you call prophylactic risk-reducing surgery for the people who have. So those are on the genetic makeup side. For the environmental, just like all the other types of cancers, these things are in the environment. You're talking about smoking, reducing the alcohol intake, or actually stopping it completely. Being, you know, physically active. You know, it's recommended exercise. At least 30 minutes, you know, at least about 4 times in a week, if not daily. The things to do with living a healthy, you know, dietary, fruits, vegetables. There are many cancers that we've known that they have shown some causative relationship with some of these things. So yes, living a healthy lifestyle would be one of the things. Yeah.
Let me come to you, Dr. How do we make these conversation out there briefly?
So number one, breast cancer is real. The incidence is high and the mortality is real. Number two, breast cancer affects both male and female. Female have a higher risk, but male still have the risk nonetheless. Number three, you can easily be treated with breast cancer, but it is crucial to understand that presenting early is the game changer for treatment of breast cancer. So doing a breast self-examination at home and also coming for a clinical breast examination and mammogram remain the key in terms of screening. In fact, as I mentioned right now, I know Tenwek for the whole month of October, they're offering free breast cancer screening. They have partnered with other key stakeholders to offer free mammogram. And this is just to enable the community to understand that this is a problem, that if we together work together, we can actually catch the disease at early stage and be able to treat them.
Dr. Kimutai Sylvester from Extreme Left and Dr. Mwenga Daniel, as they take us through breast cancer in our society is what we need to do. It is not only a woman problem, but as men as well do experience the same. Key importance is knowing your body and knowing what you to do and where to go. My name is Dennis Aseto. This conversation definitely continues, and Standard Media Group as well will be having breast cancer examination. And with that, I say asante sana for everybody that made this a success. Enjoy the rest of your viewing.
It is estimated that 11.2 billion tons of solid waste worldwide contributes to about 5% of global green gas emissions every year. A UNEP report says that